Both the symptoms and the shapes and sizes of brain tumors vary. Even yet, some symptoms, such as recurrent headaches, trouble communicating, illness, muscle weakness, and more, are more typical than others. The topic of today's video is the early indicators of a brain tumor. 10. Repeated headaches. Consistent headaches. Although they may not necessarily be the first sign of a brain tumor, headaches are a well-known symptom of this condition. It is significant to remember that a variety of other diseases, including migraines, stress, sleep deprivation, stopping some medications, and seasonal changes, can also result in headaches. However, frequent headaches may be a sign of a deeper problem. Patients with brain tumors frequently wake up with a terrible headache that gets worse with time and becomes more regular. Additionally, these headaches could get worse when you cough, move your head, or do physical exercise. 9. Seizures. Seizures are rapid, unexpected spikes in brain electrical activity that can result in a variety of symptoms depending on the part of the brain that is affected. While some seizures may be hardly visible, others may be severely incapacitating. The location of the seizure's brain origin, the person's level of consciousness at the time, and whether or not the body moves during the episode can all be used to classify seizures, a common indication of brain tumors. Seizures affect 20% to 40% of people with brain tumors, and an additional 20% to 45% may experience seizures as the disease progresses. If seizures are worse or happen more frequently, it can be a sign that the tumor is getting more aggressive. 8. Communication problems. The language center of the brain is the area in charge of processing voice and vision. This region of the brain may be affected by a brain tumor, which can impair language function and cause a number of typical symptoms. Language impairment, speech issues, memory loss, and a decreased capacity for word and phrase recall are a few of these that may be present. Other signs of language center dysfunction brought on by a brain tumor may include the inability to develop meaningful language, difficulties describing items, and trouble understanding what others are saying. Communication challenges like these might also lead to emotional issues like depression. Numbness and clumsiness. 7. Numbness and clumsiness. Neurological symptoms from brain tumors might include balance and dexterity impairments, mobility concerns, and issues with basic functions like swallowing and making facial expressions. In particular, if the tumor is found in the brainstem, where the spinal cord and brain converge, numbness and clumsiness may also manifest. Feeling unwell. 6. Having the flu. A brain tumor is one illness that frequently causes nausea. Brain tumor-related nausea may be worse in the morning or after an abrupt shift in position from sitting to standing. Raised intracranial pressure, often known as nausea with confusion or a sense of illness, is a disorder that causes an increase in pressure inside the skull. There are many causes of elevated intracranial pressure, including the existence of a brain tumor. This occurs when the amount of tissue or fluid inside the skull increases, which can cause compression and harm to the brain's tissue. The personality shifts. 5. Personality changes. Brain tumors can cause changes in personality. The brain changes brought on by the tumors may have an impact on a person's emotions, behavior, and cognitive abilities. Sometimes the psychological effects of having a brain tumor and coping with the difficulties can also lead to personality changes. Aggression, impatience, bewilderment, depressive symptoms, and mood swings are some of the personality changes that are frequently linked to brain tumors. Some brain tumor patients may also lose their inhibitions, which can result in improper public behavior. Deficit in focus. 4. Focal deficit. Focal deficits are neurological symptoms brought on by injury to or dysfunction of a particular nerve, such as those in the brain, spinal cord, or peripheral nerves. These deficiencies can cause a variety of symptoms and can specifically impact the left side, right leg, or ear. 3. Muscle deficiency. Muscle weakness. A brain tumor that presses against or moves sensitive brain structures can cause weakness or paralysis in different parts of the body. Seek medical help if you suffer weakness or numbness in your arms, legs, or face that lasts for more than a few minutes and isn't caused by sitting incorrectly. 2. Issues with sleep. Sleep issues. Lack of restful sleep is one of the most severe and prevalent signs of a brain tumor. The condition's weariness and deterioration in cognitive function can both make it difficult to fall or remain asleep. Inflammation in the brain may also contribute to sleep disruption. Common signs may include difficulty falling asleep, difficulty remaining asleep, waking up too early, and feeling drained or overly exhausted during the day. 1. Hearing and vision issues. Brain tumors can result in hearing loss, disability, or ringing, with either a slow or abrupt onset. Vertigo, drowsiness, and balance problems can be brought on by the growth of a brain tumor. Sometimes the tumor's pressure can result in face pain or paralysis. It can result in a variety of visual issues, such as double, blurry, or hazy vision, if the tumor damages the optic nerve or the part of the brain responsible for vision. Additionally, it may cause loss of peripheral vision and partial or complete blindness. Let's discuss treatment. Chemotherapy. 5. Chemotherapy. Chemotherapy is the use of medications to either kill or inhibit the growth of tumor cells. This kind of therapy is frequently used following surgery or radiation treatment, especially if the tumor has returned. The adverse effects of chemotherapy can include nausea, vomiting, and hair loss. 4. Targeted therapy. This type of chemotherapy also targets the precise genes, proteins, or environments that the tumor needs to survive. While minimizing the harm to healthy cells, this sort of treatment stops the growth and spread of tumor cells. Some tumors may have more than one target, and not all tumors have the same ones. Tests to determine the genes, proteins, and other components are necessary in order to find the best treatment. Surgery. 3. Surgical. When a brain tumor is low-grade and may be totally removed without causing major damage to brain tissue, surgery is frequently the first course of treatment. To reduce symptoms and enhance the patient's quality of life, the surgeon may decide to remove only a portion of the tumor if doing so could harm the surrounding brain tissue. A tissue sample from a partial removal can also be used to diagnose an illness and choose an appropriate course of action. Radiation treatment. Radiation therapy. 2. Brain tumors are commonly treated with radiation therapy, which uses high-energy beams to reduce and kill tumors. While internal therapy brings the radiation source within the body close to the tumor, external radiation delivers powerful beams to the tumor site. Fatigue, headaches, memory loss, and scalp irritation are possible side effects of radiation therapy. First, radiosurgery. Radiosurgery. In the classic sense of the word, radiosurgery is not a type of surgery. Instead, it delivers a highly targeted radiation treatment to eliminate the tumor cells in a very tiny region using numerous radiation beams. Each radiation beam isn't extremely strong, but the brain tumor, which is where all the beams come together, gets a lot of radiation. In radiosurgery, a variety of technological approaches are utilized to treat brain tumors. The majority of patients who undergo radiosurgery have one treatment and return home the same day. While these signals can aid in the early detection of a brain tumor, there are more indicators you should be aware of. Please provide your feedback in the box below.